BSCn News.
Elsewhere, the Kenya National Union of Nurses is now calling on President Uhuru Kenyatta to intervene and put an end to the 3-week-long health workers' strike. This after it emerged the president played a key role in the brokering of a CBA between doctors and the Ministry of Health.
Today we are out here. We've been out for almost a month and some weeks now on strike demanding for our rights as nurses of this country. I want to plead to the President and the national leaders and the national government, that is Ministry of Health, to address our issues with speed so that nurses can go back to work and serve citizens of this country. We have issues, and our issues still remain the same. Our issue, we want our risk allowance of 30,000, a comprehensive medical cover, and we would like our CBA to be approved and signed so that's our cry out there, because it's very valid and we cannot work in an environment that is very unsafe. We want to feel that we are being taken care of so that we can offer the services to Kenyans as they deserve. We know the government has taken this opportunity and this time to frustrate us, to intimidate us, because we are out here demanding for our rights. And we are asking the government to work with speed because we want to go back to work and serve our Kenyans as quickly as possible.
It is sad that at this time the government is still asleep on the issues that are affecting this nation. It is wrong that we are almost wrapping up this year, same things, same tricks, different governments. Since 2016, we've been pushing for the same issues that we are pushing now. Look at 2017, a day like today, we were on strike. There were no services that were being offered. Today is 26th of December again of another year, we are out, health services are not offered. Dear Mr. President, we saw in the newspapers, we saw what our colleagues said, that you intervened so that their issues were addressed. But I can tell you, those hospitals are still deserted because the real soldiers, and I'm saying the real soldiers, the nurses, are out until our issues are addressed. That is when those hospitals will start functioning. What we are asking is not too much. We are glad that when this pandemic came in, you appreciated that indeed we are soldiers and we are exposed. When you gave a COVID allowance, that was a clear indication that indeed we are at risk and we need to be compensated. What's changed after 3 months? The numbers are still going high. We've had a new wave again that is coming in. The measures that you're telling the nation that you're putting in place should include a risk allowance of the nurses of this nation, so that at least we are assured that even if we are going to those environments, we have something should we fall victims. A comprehensive medical cover is not something we should be negotiating about.
This is the only country where leaders go to Christmas to celebrate, and of course open up presents on 26th, when 95% of Kenyans cannot access essential healthcare services. This is the only country where people will continue to enjoy even tomorrow. We don't know whether they will come back to us on January or when. But one thing, the most underlying thing, is that these people have comprehensive medical cover of up to 10 million. They have group life insurance of up to 10 million, while the ordinary mwananchi here does not have a place to go. As a country, we are used to shenanigans. Where people are raising issues, you hear a cabinet secretary says national officials have lost touch with the reality on the ground. Where the cabinet secretary is saying the national officials are doing politics. It is not politics. When Kevin Muthomi has been found dead in his house in Chuka after working for 4 months without salary. Kevin Muthomi has died without seeing a payslip for a period of 4 months. It is not politics, Mr. CS. This is the only CS who has never made this union. You write letters, you want a consultative meeting, or you want a courtesy call, it is cancelled. You call him, he does not receive your calls. You send him an SMS, he does not respond. You go to the ministry, you want to see him, he does not see you. Then he says that we are contracting COVID-19 in bars.
Well, let's now take you live to Riverbank Primary School in Ngara, in Nairobi, which is currently on fire.